Coming to glucocorticoids, cortisol is the chief glucocorticoid. The other glucocorticoids are corticosterone, cortisone, and these glucocorticoids, they are called as life-protecting hormone. If you see their action, their metabolic effects, first on the carbohydrate metabolism, it exerts anti-insulin effect by increasing gluconeogenesis, by enhancing the breakdown of proteins in the extrahepatic cells. They also increases the synthesis of enzymes required for gluconeogenesis, and they exert an anti-insulin effect by inhibiting glucose uptake and utilization by peripheral cells. If you see its effect on protein metabolism, decrease cellular protein and increase liver plasma protein occurs by decreasing the protein synthesis by inhibiting amino acid transport into extrahepatic cells and inhibiting the formation of RNA. It also stimulates catabolism of proteins in all body parts except in the liver. It also enhances amino acid transport into the liver cells and also enhances liver enzymes required for protein synthesis. And its effect on fat metabolism, it mobilizes fat from adipose tissue and enhances the oxidation of free fatty acids in the cells. It also increases the utilization of fat for energy. Effects on electrolyte and water metabolism, increase in the retention of water and excretion of potassium by the kidney is important effect, and it also accelerates the excretion of water. Adrenal insufficiency causes water retention. Physiological actions on various organs and system effect on the muscle. There will be hypersecretion causes muscular weakness, which occurs due to the excess protein catabolism. And the effect on the bone, it increases the bone resorption and it inhibits the bone formation. Its effect on vascular system, it is essential for constrictor action of adrenaline and noradrenaline. In adrenal insufficiency, blood vessels fail to respond to adrenaline and noradrenaline, leading to vascular collapse. Effects on central nervous system, insufficiency causes personality changes like irritability and lack of concentration. And effects of blood and cells and lymphatic organ, it decreases circulating eosinophils and basophils. It increases the number of neutrophils, platelets and RBCs. It decreases the circulating lymphocyte count and size of lymph nodes and thymus. Its permissive action on some of the hormones, like some of the actions of other hormones, they are executed only in the presence of glucocorticoids. For example, the calorogenic action of glucagon, pressure activity of catecholamines, bronchodilation of catecholamines, and lipolytic effect of catecholamine occurs only in the presence of glucocorticoids. Effects in resistance to stress. Exposure to any type of stress increases secretion of ACTH, which in turn increases the secretion of glucocorticoids. And it enhances resistance by immediate release of amino acids, that is synthesis of new proteins, and fatty acids are released from the cell, which is required for energy supply, enhances the vascular reactivity to catecholamines and prevent the severity of other changes in body caused by the stress. Its anti-inflammatory effects. It blocks the early stages of inflammation process before inflammation begins. If the inflammation has already begun, it causes rapid resolution of inflammation and increased rapidity of healing. These are some effects. It is going to stabilize the lysosomal membranes so that proteolytic enzymes are not released. It decreases the permeability of capillaries so that loss of plasma is prevented. It decreases both migration of WBC to the inflamed area and phagocytosis of the damaged cells, and thus it decreases the release of prostaglandins and leukotrienes. They suppress the activity of T cells and other leukocytes so that there is a decrease in the reaction of the tissue. They also reduces the release of interleukin 1, so the temperature is reduced, which in turn reduces the vasodilatation. They also inhibits the phospholipase A2, because of which less arachidonic acid is formed, and they're also anti-allergic, which prevents various reactions in allergic conditions. And this is how cortisol uh, production is regulated. It is mainly by the negative feedback mechanism. When hypothalamus produces releasing factors, it acts on anti-repituitary to produce ACTH, and ACTH acts on adrenal cortex to produce cortisol. And this cortisol, by negative feedback mechanism, uh, uh, inhibits anti-repituitary and hypothalamus to produce less amount of cortisol. Circadian rhythm of glucocorticoid action. The secretory rates of CRF, ACTH, and cortisol are high in early morning but low in late evening. This effect results from 24-hour cyclical alteration in the signals from hypothalamus that cause cortisol secretion. Stages of inflammation. Substances that activate inflammation process such as histamine, bradykinin, proteolytic enzymes, prostaglandins, and leukotrienes are released from the damaged cells, and there will be increase in the blood flow in the inflamed area. There will be leakage of plasma out of the capillaries into the damaged areas due to the increased capillary permeability, followed by clotting of tissue and fluid causing non-pitting type of edema, and infiltration of this area by leukocytes, and lately, after days or weeks, the ingrowth of the fibrous tissue that helps in the healing